Is there a link between an enlarged prostate and prostate cancer?
Not at all. This is a major issue I face in the clinic. Patients with an enlarged prostate often fear they have cancer or that this benign enlargement will eventually turn into cancer.
Turn into it, yes.
Prostate enlargement originates from one specific area of the prostate, while cancer develops in a completely different area.
They're unrelated then.
Yes, the nature of the disease is fundamentally different. One is distinct from the other. They are two entirely different things. However, for patients with an enlarged prostate, we still perform a PSA test. This checks prostate function and acts as a tumor marker to rule out the presence of prostate cancer. And this test should be done annually, meaning it's done
Regularly.
yes, every year. As a screening, it's done annually to monitor
Just to give one peace of mind.
after the age of 50, exactly. It should be done annually.
What exactly is an enlarged prostate? And how do we distinguish it from other conditions that can affect this area?
Well, an enlarged prostate means that the gland we mentioned starts to increase in size, which is natural with age.
Right?
But the problem is that it narrows the urinary passage, creating resistance when urinating. So we have prostate enlargement, prostate cancer, prostate inflammation, and prostate congestion. These four conditions occur in the same gland, but each has a specific treatment and a distinct diagnostic method.
Is it possible for the patient to know which one they have? Or do they just know there's a problem? Or are there common symptoms between them and only the doctor can tell?
The common factor among them is that there are issues with urination.
Right, so in all four cases, the common result is difficulty urinating.
Exactly.
Right, besides aging, which leads to an enlarged prostate, are there specific cases that cause this enlargement?
No, prostate enlargement happens with age.
Right,
In younger people, it's usually prostate inflammation or congestion that occurs, but the prostate increases in size after the age of 50. Sometimes we see younger men with some prostate enlargement, but it's rare and not the rule. The rule is that what's called benign prostatic hyperplasia occurs after the age of 50.
some people more likely to be affected than others due to genetic factors, for example? Or is this condition common to all men?
No, the prostate enlarges in all men,
Okay,
but who will develop symptoms, and who will need treatment, and who will require surgery? That's the point.
yes.
But there is, of course, a genetic predisposition. A family might mostly have enlargement.
Affected by enlargement, yes.
Yes, and prostate cancer especially. Prostate cancer in particular runs in families. So if anyone in the family has prostate cancer, they must follow up and get tested to ensure everything is fine. Yes, there is a predisposition.
Right? The question now, doctor, is what are the complications that can happen to a person if they neglect treatment?
Well, we agreed that the prostate blocks the flow of urine. If this urine doesn't come out, problems will occur later. Like what? First, not emptying the bladder completely leaves residual urine in the bladder after urination.
Certainly.
This urine can become infected very easily. So the first problem is recurring infections. The second problem is if the prostate is large, it can bleed, causing recurring bleeding. The salts in the residual urine in the bladder precipitate and build up, forming a stone, so there's a bladder stone. The urine that stays in the bladder can cause reflux to the kidneys and lead to elevated kidney function levels. The bladder can get completely full, especially in diabetic patients, and they don't feel the urge or the need to go to the bathroom, so the bladder muscles start to stretch until it's like a balloon and can't contract to expel urine, causing muscle failure. So of course the prostate is very important, and if not treated or monitored well, it can cause problems.
Many problems, many problems.
Everyone, an enlarged prostate has nothing to do with erections. Prostate surgery has nothing to do with erections. It's related to the ability to
Conceive. Conceive only?
big difference.
Oh, of course, of course.
Someone might come and tell me, "Doctor, I really want to remove the prostate, but I'm afraid." Man, what are you afraid of? How many do you have? He says, "I have 12 children." Well, you have 12 children. The issue is related to fertility, not erections.